Jesse is a 6-year-old African-American male with a medical history significant for asthma. He is being seen in his pediatrician's office for a follow-up appointment after being discharged from the hospital yesterday morning. Jesse was taken to the emergency department 5 days ago, presenting with respiratory distress and hypoxic respiratory insufficiency in the setting of a possible upper respiratory infection. He was subsequently admitted to the pediatric intensive care unit for 2 days, then transferred to the general pediatric floor for further observation. Information sources are the patient's father, and the patient's medical records. Good morning. My name is Jenny, and I'm the registered nurse in Dr. Oliver's office. Are you Jesse?
Yes.
How old are you?
6.
I saw you playing in the waiting room. It looks like you like trains. I do too. What grade are you in?
First, I study first grade and I go to school.
Oh, that sounds exciting. Hi, how are you related to Jesse?
I'm his dad.
Very nice to meet you. So it looks like you are here for a follow-up appointment for Jesse because he was admitted to the hospital 5 days ago and was discharged yesterday. Can you tell me a little bit about the events that led to that?
Sure. 5 days ago, I noticed Jesse had a runny nose and cough. His 2 older brothers had colds, so he may have gotten something from them. Around 9:30 that night, on September 1st, I noticed he was coughing, was kind of breathing fast, and it looked like he was having a hard time breathing. I gave him 2 puffs of albuterol every 20 minutes for 1 hour, but I could see he wasn't getting better, so I took him to the children's ED. This was part of the asthma plan that Jesse's pediatrician helped us to make, and it helped me to know what to do during that stressful situation.
I'm glad to hear you have an active asthma plan in place. So today's appointment will involve a physical exam to check Jesse out. I've already started an assessment on your son. He's alert, he looks well nourished, and his color looks great. He's breathing comfortably, and he speaks in full sentences without sounding like he's out of breath, which tells me his body is getting the oxygen it needs. He walks without any issues. I saw him in the waiting room, and the vital signs we took before you came into the exam room all look great. Before we start the physical exam, I'd like to ask you some questions. Jesse, how about I let you play at this table while your dad and I talk for a little while? Is that okay?
Okay.
All right, come sit here. I have some toys for you, okay? It looks like they ran some blood work and took x-rays at the hospital, and Dr. Oliver is going to be here in a little bit to go over the results with you after our exam is done. Okay? And where do you live?
We live in a house in Ann Arbor.
And who lives with you?
I live there with Jesse and his 2 older brothers.
Are there any pets in the home?
No, Jesse is allergic to cats.
Any other allergies that Jesse has?
Just seasonal allergies and dust and mites.
Does anyone smoke in the home?
No, I know that smoke causes Jesse's asthma to flare up, so I try to keep him away from it. I've learned to keep him away from things that cause him to have an asthma attack, like cats, dust, people who have colds.
It sounds like you know what triggers his asthma. That's excellent. Any family history of asthma?
Yeah, my mother, my sister, my brother have asthma. Also, one of my other children is also asthmatic.
And was Jesse born full term?
No, he was 3 weeks premature, had a low birth weight. I've been told this could have added to his asthma.
Yes, you are absolutely correct. That does increase the risk of developing asthma. And how many times has Jesse been admitted to the ED for asthma?
He's been to the ED about 8 times since he was born, but 3 of those visits were just from this last year. He takes his asthma medication every day. He does his flow meter every morning. He knows how and when to use his inhaler, and all his teachers know about his asthma. But I have noticed he has needed his albuterol inhaler more frequently.
Has he ever been on ventilator support for asthma?
No.
Okay, I'm glad to hear that. It sounds like you're very knowledgeable about managing Jesse's asthma. You have an asthma plan, you're able to identify his triggers, and you keep him away from them, and you make him take his daily asthma medication, and he uses his flow meter.
What am I doing wrong?
Nothing. You're doing everything right. I'm going to recommend that Dr. Oliver refer you to a pediatric pulmonologist. Jesse's asthma management may need a little tweaking, and a pulmonologist can help you do that. Does that sound okay?
Yeah, that sounds great.
Okay. The reason I went over all of these questions is because for asthmatic children, when they're not having an asthma attack, they could look perfectly healthy. So it's really important to get a detailed history before we do a physical exam. Okay?
Okay.
Hey, Hey Jesse, you want to come and join us? I'm going to have you come on this table so we can do a quick exam. So come up on the table for me. Let's move this. All right, come scooch over here. Okay. I'm just going to listen and look at you and make sure you're doing okay. All right? I'm not going to do anything that's going to hurt, and I'm not going to do anything without telling you first, so you don't have to be afraid. Does this sound okay?
Yep.
All right. Do you have any headaches?
No.
Do you ever feel dizzy like you just got off of a merry-go-round?
No.
No? I see that Jesse takes Flovent Discus, and one of the side effects is headaches. So you want to pay particular attention if Jesse starts also acting like he suddenly is getting unusually sleepy, because I don't want to scare you, but this could mean that his brain's not getting enough oxygen during an asthma attack, okay? All right, I'm just going to shine a light in on your eye. Just look at my nose. Good. The pupils are equal and round and reactive. You know, I just noticed that Jesse has a line that goes across the bottom of his nose. Jesse, do you rub your nose a lot?
When I have a runny nose, I wipe it away like this.
Okay, we call that an allergic crease. The constant wiping up causes a crease to form horizontally at the bottom of the nose. I'm going to look in your nose to look at the color and to see how squishy it is, okay? This is going to tell me about the severity of his allergies. Look. Okay, the color looks good. It's pink and it looks pretty firm. I'm going to ask you to open your mouth, and I'm going to look at the back of his throat for color, for signs of postnasal drip, and I'm going to look at his tonsils. Okay, so open your mouth. Very good. And stick out your tongue. Okay, so the Flovent that he takes for asthma can also cause something called thrush, which is a fungal infection on the tongue. You'll know he has it if you see a white plaque-like coating on his tongue that doesn't come off. So to avoid that, make sure that you're rinsing your mouth out with water after you take your Flovent, okay? And your teeth and your gums looked healthy. Let me look one more time. Open your mouth. And I noticed that he has a very high arc on his palate. Is he a mouth breather?
My nose is stuffy, so I have to breathe through my mouth.
Oh, you have to breathe through your mouth. So let's add a referral to an allergist. Breathing through the nose is actually better for asthmatics since it humidifies the air going into the lungs, and the inside of the nose acts as a filter for allergens that could get into his airway. We should try to get these allergies under control. I'm going to check your lymph nodes. Let me go over here. Okay. They're not swollen, which is good. Your airway is right in the middle, which is where it should be. I'm going to feel your pulses, not too weak, not too strong. I'm going to give your fingers and your toes a little hug. The color looks great. The shape looks fine. That means your fingers and your tippy toes are getting blood and oxygen, so that's really good. All right, now I'm just going to listen to you. Okay, let's listen to your heart. Okay. I'm going to listen to your lungs. Does your heart feel like it's going super fast sometimes?
Forgot my line. Sometimes my heart goes super fast, boom, 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 after I take albuterol.
Your albuterol? Yep, that's normal, that your heart feels like it's dancing around after that medicine. But if you feel like that, if you don't take your medicine, I want you to tell an adult right away, okay?
Okay.
Sometimes a fast heart rate is part of a moderate asthma attack. I'm looking at the way that you're breathing. Jesse looks very comfortable. You want to look for signs that he's breathing comfortably and not having a hard time breathing. His nares may look like they're getting bigger when he takes a breath if he's struggling to breathe. And you may see what they call pulling or tugging around here or like on the by his rib area. You may hear a wheeze. And if you see any of those things, you want to administer his albuterol right away.
If it's hard to breathe, I take my medicine and tell my dad or my teacher right away.
Well, he sounded clear right now, and I can hear air movement equally on both sides. All right, so I'm going to have you lie down. Okay. It feels nice and soft. Does your tummy hurt at all?
No.
Okay. Let me listen for gurgles. Let's see what your tummy has to say. Okay, you have really good bowel sounds. Your stomach is soft and it's slightly rounded, which is fine. I can feel his liver, which is good. Does this hurt?
No.
Okay, an enlarged liver could indicate problems related to his asthma, kind of like a backup congestion on a freeway. This can happen if his chronic asthma causes obstructions to blood flow, and it could just back up into his liver. If he complains about pain and his tummy starts looking kind of enlarged, make sure you consult Dr. Oliver, but it feels fine. Do you poop every day?
Yep.
Does it hurt when you pee or you poop?
Nope.
Okay, great. You can sit up if you want. So I read in the chart that Jesse has eczema. Come sit over. I'm not done with you, Jesse. Come sit here. That Jesse has eczema. And you can see it. Let me see your skin. Your skin looks good. The color looks fine. But you can see that he's got eczema here, like in the creases of his elbows. Let me check behind your knees. Yeah, I see some eczema behind there, which are common spots for eczema to appear in children his age.
Is that normal?
That's actually really normal. Children with eczema are often diagnosed with asthma, so we see this a lot. Just continue with the creams that we prescribed. Okay. Now you can come off of the table. Okay, and I want you to come and stand right here for me. Okay, Jesse, and can you bend over and just touch your toes? Okay, just look down and touch your toes. And I'm checking to see that his spine is straight. Some kids have something called scoliosis, which is a curving of the spine. Okay, you can stand up. He has good posture. We took his height when he first got here, and we'll continue to monitor his growth since the inhaled steroids that he takes for his asthma can slow down growth in children. Let's see you walk over there and come back. Okay, come right back. All right, now can you jump on one foot for me? How about the other one? Good job. All right, well, let's sit down and finish talking, okay? Okay, so his exam looks really good. Right now, his lungs are clear. He doesn't look like he's having any respiratory difficulties, and he's breathing very, very comfortably. Can you tell me some of the symptoms to look for that let you know that he's having an asthma attack?
Yeah, coughing, wheezing. If he looks like he's having a hard time breathing, his nostrils might get larger trying to breathe.
Excellent. Jesse's family history of asthma, his gender and race, his premature and low birth weight history, his allergies, and his eczema all put him at a higher risk for asthma. We talked about getting you into the pediatric pulmonology clinic to help better manage Jesse's asthma, and also an allergist for his allergies. Do you have any questions so far?
No.
You mentioned Jesse does his peak flow every day. That's a great health promotion activity. What other activities do you do?
We've actually started doing yoga together as a family. I find it helps us relax and makes us feel better.
That sounds great. And since getting sick can trigger an asthma attack, make sure that hand washing is a priority. Have you gotten your flu shots this year?
We've all gotten ours. They gave one to Jesse before we left the hospital yesterday.
Okay, great. And how is Jesse doing in school?
He's right on track and gets good grades.
Good.
I have a lot of friends and I really like my teacher, but there's a boy in my class makes fun of me when I use my inhaler. But I know it helps me to breathe, so I just take it and I tell my teacher he's being mean.
I'm glad you have your teacher there at school that you can talk to when somebody's being mean to you. So you're doing a great job. You keep it up, okay? What other activities do you do as a family?
We attend Mass every week. We're Catholics.
Oh, good.
I used to pray to God to make my asthma go away because it embarrassed me about my medicine. My Father Fred told me that God made all of us special, and then I feel better.
It sounds like you have a really strong spiritual connection with each other and with your clergy.
Yes, it brings us great comfort.
Well, thank you for coming in today. We'll get Dr. Oliver in here to finish up the appointment, and we'll make sure that you get those referrals before you leave. Okay, stay right here.
Thank you.